Good morning, everybody. My name is Lauren Ramirez. I'm joined by Jamie, Lauren W., and Victoria. And our project is clarifying the occupational therapist role in families' NICU to home, transition planning and process. Our faculty advisor is Dr. Brigitte Desport. And I'm just going to start with an introduction. So the experience of having a medically unstable baby placed in the NICU immediately after birth brings feelings of immense grief and anxiety to parents. Parents have reported a lack of resources regarding the long-term development of their infant, financial struggles, and after prolonged periods in the NICU, as well as external struggles such as caring for other children and medical challenges that the parents face themselves. Many dedicated healthcare workers attend to baby and parent while in the NICU, but there is a major gap in care once the family transitions to home. Our project is in phase 3 of an IRB-approved study. It aims to clarify the role of occupational therapists in the transition process, advocate for OTs as leaders in the transition process, and develop resources for caregivers. The purpose of our study was to collect information about how occupational therapists are involved in the NICU to home transition planning and process at their facilities. The data collected helped us better understand the roles and determine if the family-directed NICU transition formerly referred to as the NICU transition contract, could be integrated in both the transition planning and process where OTs are more closely involved in taking the lead.
The first step that we had to conduct in our research project was to go through all of the literature as it currently stands. We were able to then break this up into 3 major themes that we found. First, we explored how the NICU is currently structured. We explored who facilitates the transition process, and we found that usually this is the nurse practitioner or a neonatal nurse practitioner, and also the scope of their role. We also explored how the family integrated care model and just family-centered care in general is regarded as an effective method to empower families to be integral caregivers while their babies are still in the NICU, but there are gaps between healthcare workers actually implementing the FI care in the NICU. We then explored some non-medical factors that led to a difficult transition from the NICU. Some of these factors included parent anxiety and other mental health factors, socioeconomic status, a lack of trust in the healthcare system, language barriers, and cultural awareness. Finally, we explored how the current occupational therapy scope of practice and how the framework of the occupational therapy profession outlines specific pillars and skills that can be utilized to support parents and infants in the transition. OTs are educated in child development, interventions across the lifespan, and patient education. 2 OT interventions that are currently used widely in the NICU include Parent Education Empowerment Program, also known as PEEP. Oh God, that was even worse. And Therapist Education and Massage for Parent-Infant Outcomes, also known as TEMPO.
So from our literature, we found that despite OT's applicable knowledge, they do not currently hold a prominent role in facilitating the transition process from NICU to home. We also found that OTs are uniquely qualified to support parents in this transitional time. The framework of the occupational therapy profession outlines specific pillars and skills that can be utilized to support parents and infants holistically in this transitional time. This scope includes parent and caregiver education for strategies related to the child's care within the NICU. Currently, there is little research to highlight the role of OT in the continuum of care from NICU to home. And in order to research this question further, we developed a survey to be used to clarify the current role of OTs in NICUs across the US.
To be included in the study, participants must be registered occupational therapists currently working or practicing in the NICU in the United States. Inclusionary criteria included occupational therapists working full-time, part-time, or per diem. It was also required that they be fluent English speakers. Exclusionary criteria included OTs not working in the NICU, occupational therapy assistants, and other neonatal therapists. Our study was an original mixed method research consisting of a Likert scale and open-ended questions, which were distributed via email and social media. Surveys were completed and analyzed through REDCap. The REDCap questionnaire began with a set of screening questions. Those who did meet the criteria for inclusion were provided the waiver of informed consent. Once accepting, the primary questionnaire included the following sections: demographic information, 12 Likert scale response questions, and 10 open-ended questions. The Likert and open-ended questions focused on respondents' involvement in the NICU to home transition planning and processing at their facility. Participants were recruited through convenient sampling via email, LinkedIn, social media such as Instagram and Facebook, and OT Commune, the American Occupational Therapy Association discussion forum. Participants were initially sent an email with a recruitment flyer as an attachment and were requested to contact the primary investigator. Multiple follow-up emails were sent to participants as reminders to complete the questionnaire. Participants were recruited through LinkedIn, were sent recruitment messages with a link to the questionnaire. To recruit through Facebook, Instagram, and OT Commune, the recruitment text was posted publicly for potential participants as well as the flyer. And this is an example of the flyer that was posted and sent in emails.
To go over a few of our quantitative results, so participants were asked to rate 12 statements on a Likert scale that ranged from almost always agree to never agree, and we would like to highlight a few key results from our data. 50% of our participants said that they were seldom or never the primary facilitator in the NICU to home transition, and only one OT reported being almost always the primary facilitator. 73% of our participants said that they almost always or always collaborated with nursing staff during this transition process, and this demonstrates that at this time period of care is highly interdisciplinary and collaborative. 84% of the OTs we surveyed said they always or almost always provide one-on-one parent sessions on how to care for their babies in the home, and this demonstrates that OTs are uniquely educated and trained on how to support both parents and babies at this time. 100% of our participants said that they never or seldom conduct home assessments to ensure a safe environment for a baby transitioning from the NICU to home, and this identifies a gap in care that can be filled by occupational therapists. Overall, our quantitative results indicated that OTs are currently providing one-on-one sessions with parents prior to their departure from the NICU, yet they're seldom the facilitator of the transition to home, and they never conduct home visits or assessments to determine safety when at home. These results indicate a gap in care between the NICU to home and emphasize the expertise of OTs to use their knowledge alongside other health professionals to bridge this gap.
Then we examined our qualitative data. This really allowed, or our 10 open-ended questions really allowed us to hear from the OTs in their own voices about how they perceive their role within the home transition. 50% of participants believe the role of the occupational therapist is not clearly defined in the transition to home process. Family readiness to take the baby home was often assessed via a 24-hour room, which is basically just like a simulated home environment where you could run like a final dress rehearsal before you take your baby home. There were some other observational processes in place, and hospitals also provide checklists. 16% did note that there was no such readiness assessment in place at their facility. While the quantitative data revealed that OTs do provide one-to-one caregiver education, the survey results reveal that OTs still wish for more education opportunities. 38% of OTs stated that they wish to play a more active role in the post-discharge follow-ups with families, either that's via telehealth check-ins, home-based treatments, or follow-up clinics like we have here at Downstate. Participants noted that they wished for a standardized assessment, while another hoped for a specific NICU to home therapy program to be developed. Additionally, 61% of OTs noted that there is no current measurement in place to determine the effectiveness of the NICU to home transition.
OTs in the NICU desire to have a more clearly defined role and stronger presence in the discharge process. They also express how they would want more transition-related resources and tools to support the OTs themselves, the families, and of course, the babies. This would include a universal tool with defined roles for OT that contain a detailed procedures and checklists. From our results, as previously stated, we revealed that OTs are rarely given opportunities to collaborate with outpatient services and do not complete home assessments. Similar limitations exist in providing classes versus one-on-one instruction, which include difficulty in coordinating family schedules, potential cultural differences and distrust in the medical team, as well as language barriers and staffing concerns. I'm now going to read a quote that comes directly from our qualitative data that our group believes highlights the purpose of our project nicely, so I'm going to pull it up so you can read along. It says, OT usually has a clear perspective not only into the baby's readiness for discharge, but also the parent's readiness, confidence, and concerns. Just from this quote, we could see why the role of OT should be further explored. This was one of many quotes that we gathered in our data that support the overarching theme that OTs contain a certain skill set that could be beneficial in this transition process and can be implemented if given a bigger role to help bridge any service gaps.
Before we conclude, we want to talk about a few limitations in our data. Our sample size of 18 occupational therapists is smaller than our original recruitment goal, and this led to a few difficulties in drawing meaningful conclusions from some of the Likert scale and open-ended questions. The questionnaire is also lengthy due to pre-screening questions, those Likert scale questions I've mentioned, and the open-ended questions. While not all of these questions were marked as mandatory, some participants only completed the pre-screening and then the screening questions and failed to complete the questionnaire itself. And we attribute this to a lack of free time for healthcare providers to complete surveys such as this one. Lastly, there was a large lack of diversity in our respondent population. 100% of our participants were white women living in the US, and therefore our data represents a very specific demographic and is not inclusive of viewpoints from diverse backgrounds.
So in conclusion, this study illuminated the current roles of OTs in the NICU transition to home plan and process and how it could be improved if they were given a more dominant role such as a primary facilitator or at least a consistent collaborator. The data reveals aspects of the NICU to home transition process that OTs are willing and able to address. It also revealed themes of a desire to have more opportunities to provide caregiver education while families are still in the NICU to increase family readiness. This includes taking a more active role in the follow-up care along with consistency and collaboration throughout this process. Continuation of this project in future phases will include introducing the Family-Directed NICU Transition Form, or the FD&T for short, which was collaboratively developed by families in previous phases. This would be a useful tool in assisting to develop a more structured process within the NICU setting. This form differs from a standard NICU discharge checklist by adding and highlighting OT principles such as developmental milestones, family support services, and more. In addition, this can help possibly minimize the load of nursing, who are the primary facilitators of this process at this time. Overall, we hope to see OT taking a bigger role and possibly be a primary facilitator in the NICU to home transition. Some of our resources. Any questions? Questions?
I actually have a question. I wondered if when you were surveying the OTs that work in NICU, did any of them speak to whether they tried to create programs within their facilities or collaborate with like early intervention to work on that transition or the home safety checks or anything like that in your survey?
Some spoke about how there was a lack of carryover into those early intervention available programs that are available. As far as I remember, I don't think anyone said that they were like actively trying to be like to create a program or do anything. So that's why I think having, we asked for their follow-up information and their contact information so that potentially in the future when we, reach back out to them with the FDNT form as a possible resource to use, that this might be something that they'd be willing to implement. So they don't have to create it. Well, we have created it for you.
Thank you. Are there any other questions in the audience?
Thank you. Oh, thank you so much for that. You highlight a very critical period in the care of, neonatal population. With you going so much in depth in this study and understanding the gap, I'm curious, in addition to the checklist that you mentioned, are there other areas that OTs can advocate for their role, whether it be on an interdisciplinary team within an organization, or perhaps on a policy level, where OT certainly has the education and experience to, improve the quality of care, but perhaps have not been given the opportunity?
I think one space that answers this question a little bit, I thought it was really kind of remarkable that 100% of the OTs said that they don't do any home assessments, and I feel like that's a bigger gap in care than I anticipated going into this study. So I think that that's a place that OTs can also advocate for themselves, and I don't know if that would be home care OTs or what the exact role would be, but having someone that can follow from the NICU and maybe start before the families leave the NICU and then go into the home as well, I think would be really valuable, because people who are working in hospitals, their care tends to end at that hospital and switch to outpatient. So having someone that can be fully in that transitional time would be really beneficial.
We just want to thank Dr. Desport and all of our participants. Thank you.